1 in 20 Australian children have ADHD, and now a new study is revealing the impact of medication on their health.
Researchers from Deakin University studied 4,000 children over 13 years and found kids taking common ADHD medications have poorer health outcomes. Australian Medical Association President Dr Danielle McMullen joins us live now from Brisbane. Danielle, good to see you this morning. So what did you make of the findings in this study?
Look, the main finding in this study, which looked back at surveys of children and their parents over 13 years, was that kids who have symptoms of ADHD report a poorer quality of life than kids without ADHD symptoms. Now, that's not a surprise, but what this showed us was that over the course of their childhood, that 13 years, that persists. And so it's really important that we look after kids with ADHD. The finding about medications was, by the author's admission, a smaller one, and one that really just needs more research rather than definitive findings from this paper.
I think that's the most important point here, because there's so much pressure on parents anyway, and it can be really difficult if your child has ADHD, and for many of them, turning to medication seems like the only way.
Yeah, look, obviously the decision about whether to trial medications for any health condition, including ADHD, is one that should be done after close consultation with your doctor. Parents and families and children and doctors really need to work together on this to make sure that there's teamwork involved in that trial, and that we're doing more than just medicines, that it's also about lifestyle supports that can also be put in place alongside medication options where they're necessary.
It's also, I mean, and this is the hard thing about this stuff, there'd be teachers who say to parents, hey, your child is showing symptoms of ADHD, they're unmanageable in the classroom, they need to go on medication. The whole thing is so difficult and fraught.
It is really tricky. None of this is easy. We know there are lots of studies that actually show that ADHD medicines, both in children and in adults, reduce those symptoms and make it easier to manage at school or at work and in their lifestyle. But it's important to also recognise that we've got to do things alongside medicines. Medicine isn't the only answer, but it's certainly part of the answer to help children focus at school and succeed in their school and other lives.
Doc, I mean, the number of 12 to 17-year-olds who have been prescribed ADHD medication has tripled in the past decade, but so have the cases of ADHD. Is it just that we're becoming much more aware about it now? There's a greater awareness across society of the symptoms to look for and how to best treat a child.
There's definitely been a huge increase in diagnosis of ADHD, both in children and in adults, particularly in women, in female children and adults. And so that has led to that increase in medications, but also that increase in awareness of the condition and what else we can do to help manage it.
So what's your takeout then?
The takeout here is, if you're concerned that your child may have symptoms of ADHD, go talk to the doctor. Make sure you're discussing things like sleep, nutrition, exercise alongside medications, and really making that whole of health decision to best support your kids.
Such a hard decision for a lot of parents. So good on your doctor. Thank you.